everyone, and welcome to this webinar on improving vaccination acceptance among healthcare workers. What we will do is just wait a few minutes for everyone to just join us. So give us just a couple of minutes and we will start. Thank you. And colleagues, Dr. Andreas De Francisco, Director, Family Health Promotion and Life Course Department, PAHO. Dr. Joy St. John, Executive Director, Caribbean Public Health Agency, and as we all know as CARPHA. Ms. Margaret Smith, Chair of the Regional Nursing Body. Colleagues from CARICOM Secretariat, University of the West Indies, Chief Medical Officers, members of the SITAG, EPI managers and teams, healthcare workers, PAHO focal points in immunization, health systems and services, human resources for health and communications, and national, regional, and local teams working on vaccine demand and vaccine safety. I welcome you. I welcome you to this webinar on improving vaccination acceptance among healthcare workers, challenges and opportunities. This morning, the PAHO team will present the methodology, results, and recommendations of the study Concerns, Attitudes, and Intended Practices of Healthcare Workers to COVID-19 Vaccination in the Caribbean. We will also share PAHO and WHO tools developed to support healthcare workers and present a policy brief on increasing vaccine acceptance among healthcare workers in the Caribbean. And lastly, provide an opportunity to respond to participants' questions regarding the study and vaccination acceptance among healthcare workers. Before I go on, I welcome you to use the interpretation button. We have translation available in English, French, Portuguese, and Spanish. I also ask you if you have any questions to please use the question and answer button. It's there marked at the bottom of your screen, Q&A. And once you place your questions there, I will endeavor to answer all that I can, myself and the panelists, on air, and any that we can't answer, we will attempt to directly respond in the question and answer chat. Or any others, we will try to answer them after the webinar. Please make use of the chat for any of your comments. At this time, I would like to welcome Mr. Dean Chambliss, Sub-Regional Program Director for the Caribbean from PAHO WHO, to give us the opening remarks.
Thank you very much, Dr. Broom, and good morning, colleagues. Protocol having been established by Dr. Broom, I recognize the many distinguished participants today, and I will proceed with my opening remarks. It certainly gives me great pleasure to welcome you to this webinar, hosted by the PAHO Immunization Unit and the Caribbean Sub-Regional Program Coordination Office. Our objective today is to provide an evidence-informed approach to COVID-19 vaccine acceptance among our valued Caribbean healthcare workers. The COVID-19 pandemic has resulted in massive global social and economic challenges. As of 1 October, over 233 million cases and 4.8 million deaths have been reported to the World Health Organization. At the same time, as of 29 September, over 6 billion vaccine doses have been administered globally. Here in our region, including 29 CARICOM countries, associate countries, and the Dutch and French territories, just under 500,000 COVID-19 cases and some 10,000 deaths have been recorded, with numbers rising with the community spread of the Delta variant in many Caribbean countries. At the same time, a pervasive, damaging infodemic has caused many persons, including some healthcare workers, to question the safety and effectiveness of COVID-19 vaccines. This concerns us all. As public health institutions, our healthcare workers are our highest priority, not only because of their frontline role and exposure in caring for those who are ill, but also because of their important role in encouraging their clients, friends, and loved ones to accept vaccination as an important tool in fighting COVID-19. We know that healthcare workers are seen as credible and trusted sources of information. This was one of the notable findings in the recent COVID-19 vaccine acceptance study carried out by CARFA in the Caribbean. Healthcare workers can influence attitudes and behaviors in the public sphere. However, vaccine acceptance has proven to be a complex, multifaceted process that involves the way people think and feel about vaccines, social processes that drive or inhibit vaccination, individual motivations to seek vaccination, and practical factors involved in requesting and receiving vaccinations. PAHO therefore recognized the need for a better understanding of vaccine acceptance among healthcare workers in the Caribbean in order to inform and enable more effective COVID-19 vaccination initiatives. To this end, PAHO administered a mixed method study in March to April of 2021 in 14 Caribbean countries entitled Concerns, Attitudes, and Intended Practices of Healthcare Workers to COVID-19 Vaccination in the Caribbean. My colleague, Dr. Benjamin Puertas, will provide information on the methodology, results, and emerging recommendations from this project. Findings from the study presented today complement CARFA's research and will allow us to improve implementation strategies and tailor communication approaches for COVID-19 vaccines, increasing confidence in immunization in the Caribbean. We hope that this will contribute to increased vaccination acceptance and therefore coverage among healthcare workers, and by extension, the general public. All variants of the SARS-CoV virus are dangerous, but we have the tools to protect ourselves and our loved ones. We must continue to use these tools. First and foremost, vaccination, and physical distancing, masking, good ventilation, cleaning hands, and practicing respiratory hygiene. Vaccines prevent severe disease and death, even with the Delta variant. At this point, billions of persons have been vaccinated worldwide, and the vaccines have proven both safe and highly effective. We are excited to share this study with you, and we look forward to the discussion and collaboration that emerges during this event. Evidence-based insights, alongside practical suggestions and informed action, are key to addressing the ongoing challenges faced in combating COVID-19. Thank you, and back to you, Dr. Broom.
Thank you so much, Mr. Chambliss, for those words. And I want to echo a couple of the words that you said. Healthcare workers are our highest priority. Creditable and trusted sources of vaccine information. That is so important. And those words really were the impetus for PAHO to go forward with this survey, and why PAHO felt it was so important to get the attitudes and knowledge of healthcare workers, because we know that if we can understand the thinking of healthcare workers and we can target them with communication messages, then they in turn will use those same messages, that same accurate information, to influence others to be vaccinated and also give accurate guidance. So you did a good job of introducing Dr. Puertas, and I am going to continue on that vein. I will now ask Dr. Benjamin Puertas, and he will be joined by Dr. Martha Villandia, and they will be presenting on the methodology, results, and recommendations of the study, concerns, attitudes, and intended practices of healthcare workers to COVID-19 vaccination in the Caribbean. I hand over to you, Benjamin, and then in turn to Dr. Villandia.
Thank you very much, Dr. Broom, and welcome to everyone again. I'm sure you can see my presentation, just to confirm.
Yes, we can, Dr. Puertas. Go right ahead.
We already heard from Mr. Chambliss and Dr. Broom how important are healthcare workers in influence in the general population in terms of COVID-19 vaccine. Additionally, healthcare workers are a priority group and influencers of attitudes and behaviors in the public sphere. One study mentions that 85% of the population indicated their own doctor or healthcare provider was the most trusted source of information. And we can see that vaccine hesitancy among healthcare workers was a serious problem. And in several countries, we found some data, like in the US, in one article, 15% of the healthcare workers who were offered the vaccination, they refused to take the vaccine. There was a study that mentioned 22% of vaccine hesitancy among healthcare workers in Spain and 26% in France. The purpose of the study was to contribute to an increasing and improving knowledge and attitudes about healthcare workers, enabling programs to design, target, and evaluate interventions to achieve a greater impact with more efficiency, and to examine and understand comparable trends over time. We, as objectives, the study searched to gather and use quality data on the behavioral and social drivers of vaccination and COVID-19 among healthcare workers in the Caribbean, and also to improve implementation strategies and tailor communication approaches on COVID-19 vaccines and vaccines in general in the Caribbean. And this whole event goes around that, to present the findings, the recommendations, but also to present some options and solutions that we can see are going to be effective in the Caribbean. The methodology, this is a cross-sectional study using a survey applied to a cohort of healthcare workers working in participating Caribbean countries. We mentioned 14, which is a very good number of countries, considering the period in which it was carried out. And that was during the, where we have been living in the pandemic since last year, but still it was hard to get all these people to participate. The instrument, the survey was based on a tool in Data for Action, that's a WHO and UNICEF tool, achieving high uptake of COVID-19 vaccines, and also out of a questionnaire developed by the University of California at Los Angeles. We use a Likert scale with 4 options: strongly agree, agree, disagree, and strongly disagree. You can see in this table the countries that participated in the study. We have 14, and we did a calculation of a sample size by sub-region and also by country size. So we have the sample size calculated was a minimum of 761 to achieve a number that could give us a good idea of what's going on. You can see to the right the healthcare worker categories, and we classified those categories into 5 broad categories, as you can see below: doctors or physicians, nurses, public health professionals, allied health professionals, and other. The instrument had those components that you can see: attitudes towards vaccines, vaccine readiness, attitudes towards COVID-19 vaccine, and attitudes towards influenza vaccine. And the reason why to include the influenza vaccine was because we wanted to compare to a vaccine that has been provided to adults in the Caribbean, and that's the influenza vaccine. We carried out a pilot in 2 countries with 7 respondents that represented 3 healthcare workers categories. So we use a structured interview that also was provided as one methodology from the WHO behavioral and social drivers document. And this is the survey. It took about 7 to 9 minutes to complete it, including the confidence approval. This survey was translated to French, so we could include Haiti as part of the countries in the Caribbean that responded. And data collection, we had Qualtrics, the platform we use it to have an electronic survey that could be sent to all the different countries. So to do that, we use, and we appreciated the support of our PAHO country offices, the HSS, which is Health Services and Systems focal points, as well as our Human Resources for Health focal points, and FBL focal points as well, Family and Life course. So then we also distribute the survey to our counterparts and partners, the sub-regional entities such as CARICOM, the regional nursing body, to academic institutions such as the University of West Indies, CMOs, CNOs, flyers. You can see also that we developed a QR code that was easier to share, especially with the healthcare workers that could fill out the survey using their devices. We also had the flyers, like the one that you can see here, that they were placed in strategic locations. And it's important to mention that the survey and the whole study was approved by our ethics committee. This is PAHO-ERC. And the quantitative analysis, we used binary consolidated response categories, that's agree and disagree. And they were analyzed using chi-square statistics. The p-values were used to confirm that the patterns in proportions were significant. And this was something very important. What did we use to measure vaccine hesitancy? And we chose one proxy question that had to do with this question in particular. If a COVID-19 vaccine becomes available, I intend to get it as soon as possible. And the literature, we found also some other countries that use the same proxy question. So this gave us the strength we needed. Those who disagree or strongly disagree were considered to be then COVID-19 vaccine hesitancy healthcare workers. Additionally, we used multivariable logistic regression to assess outcomes for every opinion question. We also had a qualitative analysis, and this is very important to mention because at the beginning we thought that it was not going to be as strong as it became, but we had 5 open text responses that you can see in the left table. And what we did is we got such an amount of very interesting information in these areas that we had to categorize them according to WHO 4 domains that you can see to the right: thinking and feeling, social processes, motivation, and practical issues. And then the responses were coded by the survey team. My colleague, Dr. Velandia, will go into the results of this analysis. And that is a table that summarizes the respondents by country and healthcare worker category. It's important to emphasize that we got 14 countries engaged and almost 1,200 healthcare workers. These are physicians, nurses, pharmacists, and other healthcare professionals who responded. And these, we had more, but those are the surveys that were completed and after the filter were okay to be included in the study. So I had pointed out, as you can see, Trinidad and Tobago, because we calculated, as you saw in the previous slide, sample size by country and sample size by sub-region. So the idea was also that in cases like in Trinidad and Tobago, they did not only achieve the sample size for the sub-region, but also they even achieved and surpassed the number for a country analysis. That's what's happening now. Trinidad and Tobago is doing their own analysis with their own results and comparing it with the sub-regional results as well. So most of the responses were from physicians, which is a bit, we were expecting to have more nurses, but as you will see, nurses were more hesitant, and that could be a reason why we didn't get more nurses to respond. I will stop here and I will pass to my colleague, Dr. Marta Velandia, who will continue from here on. Thank you very much.
Thank you, Benjamin, and good morning, everyone. I walk through you the results. Benjamin, could you please put on full screen?
Yeah, sure.
Okay, so here we have the demographic distribution of the 1,197 respondents, 75 of the respondents were female, and 309 were people between 21 to 32 years of age. 43 of the participants, as Benjamin just mentioned, were physicians, and 95% of the nurses were women. Next. I will present this type of tables over the results section. So the color bars are scale. So if 100% of respondents gave an answer, the entire cell will fill with color from left to right. Also, if there is any difference that is statistically significant, we will see the numbers in bold. For example, here, concerning attitudes to routine vaccine, 98% of the respondents display agreement that vaccines are important for their health, with no statistical significant difference. I mean, everyone agreed that vaccines are important for their health. And 95% of the respondents agree that vaccines are safe. And we don't see numbers involved, so of course everyone has the same opinion about vaccines. Next one, please. Next one, Benjamin, please. Thank you. Despite the overall agreement on the importance, safety, and efficacy of vaccines, healthcare workers display some concerns when it comes to new vaccines. 56% of all respondents agree that new vaccines carry more risk than older vaccines. And here we see variation between healthcare workers categories. So for example, you can see 48% of physicians agree with this statement, but 65% of nurses agree with the statement, and 64% of the allied professionals agree with the statement. And you can see the bold numbers, so those numbers were statistically significant. Next one, please. Likewise, 77% of all respondents concur that they are concerned about serious adverse events of vaccines. But physicians displaying the least level of agreement, just 73%. If we compare against nurses, 82%, and allied professional, 82%, allied professional, 82%, sorry, and others, 85%. And all those were statistically significant. And here I want to bring your attention to the age at the bottom of the slide. We divide the age by quartiles. And the youngest respondents, people, the youngest one, people between 21 and 32, were more concerned with adverse side effects compared with the oldest respondents. And this difference is also statistically significant. Next one, please. When asked regarding attitudes and perception, specifically against or related with COVID-19 vaccine, we found differences. Overall, 92% of the respondents agreed that a COVID-19 vaccine will protect against severe disease. Physicians were the most confident among healthcare workers, 96%, and nurses and allied professionals were least confident, 85 and 82 respectively. And as you can see, those differences are statistically significant. And again, the youngest quartile display less belief in the effectiveness of a COVID-19 vaccine compared with the other quartiles. Next slide. 83% of the respondents overall were confident in the scientific process of approval of COVID-19 vaccine. Physicians, again, were 88% confident, while nurses, 76%, and allied professionals, 72%. with difference in statistically significant difference in this comparison. Again, youngest were less confident in the scientific approval of the COVID-19 vaccine compared against the eldest quartile. Next. As Benjamin mentioned, we consider to be a COVID vaccine hesitant to those participants who disagree or strongly disagree with this statement. If a COVID-19 vaccine becomes available, I intend to get it as soon as possible. Overall, 23% of the respondents display some level of vaccine hesitancy. So 23% of all the respondents say, no, I prefer to wait. I don't want to have the vaccine right now. And here we can see, again, difference across the healthcare workers. 15% of the physician, you can see here, and 34 for nurses, and 38 for allies. The asterisk means that there were statistically significant differences. Again, next, please. The difference between sex were not significant, the blue bars. But when we see the age quartiles, again, we have difference among younger healthcare workers and the eldest. And those differences are statistically significant. Next one, please. 1/3 of the participants didn't know enough about the vaccine to make a decision. Mainly the critical care nurses. And again, the younger age group compared against the 4 quartiles. Next. 47 of the respondents agree that the development of the COVID-19 vaccine may have been rushed, or vaccines may not have been thoroughly tested. 38% of physicians agreed with this, compared against 60% of nurses and 65% of allied professionals. The youngest respondents, again, were more in agreement with this statement compared with the other quartiles. Next. Social media shaped the opinion on COVID-19 vaccine, mainly in the youngest quartile, if we compare this with the eldest in this opinion shaper. Next one. Now I walk through the qualitative analysis. As Benjamin explained, this is the model. This here we have the WHO behavioral and social domains and constructs that were used to categorize the opinion expressed in the free text response that were so rich. So here we have 4 domains: thinking and feeling, motivation, social processes, and practical issues. And inside each of these domains, we have constructs. The constructs are like a theoretical representation of the responses. And I want to call your attention to the constructs with a black border, with a black bold border, because those were new constructs that we identify among the Caribbean health workers using this survey. For example, this one that expressed that respondents would be more inclined to accept vaccination if their preferred vaccine brand was available. Next one, please. And here we see, sorry for the very full slide, but here we can see some of the main constructs and the domains. And here we can see that the majority of the respondents, the majority of the concerns correspond to the thinking and feeling domain, the first one, the yellow one. and the primary construct identified as part of the qualitative analysis was related with doubts regarding vaccine safety. Many respondents point out to their concerns regarding potential long-term side effects caused by a vaccine as a reason for refusing or delaying the vaccine. Similarly, an important number of answers fell under the construct related to confidence in vaccine benefits. Among the reasons expressed were the uncertainty of the length of the immunity provided by vaccines, as well as the lack of protection against the variants of concerns. Among the response classified under social processes, the blue one, I want to underline the most influential number of answers were the lack of confidence in their health authorities. Respondents' concerns were on issues such as authorities handling the pandemic and the messaging to communicate to the public. And this issue was exacerbated when it's combined with safety concerns that we saw up in the slide. Next one, please. So now I want to talk with you regarding some consideration. As all our colleagues have mentioned, healthcare workers are the first priority because they are the first people to be vaccinated against COVID-19 vaccine, but also because they are the most trusted source of information to the public. Based on the results that we just show, we think that we need to strengthen educational campaigns that increase risk perception of disease versus vaccination, targeting specifically healthcare workers category and a different age, as we can see in the results. And this is a two-way communication. We have to allow healthcare workers to express doubts and ask questions, and without any judgment. And the most important thing, responding with transparent and factual information. The capacity building, because as we have mentioned, the healthcare workers are the people who is talking with the public. So we have to strengthen this capacity building and train healthcare workers to talk with the community about vaccines, about vaccination, solve their questions too. So this is another important aspect to strengthen. We have to involve healthcare workers in the design of vaccination interventions. And of course, we have to improve access to healthcare workers to vaccination. We have to offer vaccination services at work, during convenient times, and if needed, a time off. And this is another very important issue, the importance of trust spokesperson to address healthcare workers, to address these concerns about vaccination. Next. And I want to bring this almost last slide regarding actions that we have been taken and the next steps. As I mentioned, we found one of the reasons for hesitancy, the issue of they want to have one specific brand of vaccination. So we started with preliminary reports and developed this strategy. The best vaccine is the one available to you first. As we have mentioned, this is another important issue. We want to do this kind of studies in other parts of the region. And here, let me tell you that today, the Strategic Advisory Group in WHO, they had today a meeting and they present this model, and they encourage regions and countries to repeat this kind of exercise. So we are more than willing to work with you for implementing this kind of studies. We are working to develop a course specifically on vaccine hesitance in healthcare workers, and continue. And already we have this communicating about vaccine safety. That's a virtual course for healthcare workers in 4 languages, and it's available in our webpage. Later on, Dr. Puertas will through us this policy development in the Caribbean. And of course, we are working in additional communication support to increase risk perception of COVID-19 vaccine disease versus vaccination. Next one. Just for you to know, the full report is available. And in the full report, you can find these recommendations, but domains, indicator, intervention, category, and description. And I think this is one of the most valuable things, because now you can use this in a very practical way to develop the best, tailored communication strategies for your healthcare workers in your country. Next. Finally, I want to highlight some strengths and limitations of our survey. Among the strengths, we have it was widely publicized, and online survey was available for 50 days. It was an important net of healthcare workers to respond. It was available in French and English. The pretest, as Dr. Puerta mentioned, help us to clarify some phrases and in the survey tool. The open questions help us to, it was so rich, and it helped us to understand better all these issues regarding the hesitancy in the healthcare workers. It was very important that the disagreement were resolved with a third party in this classification of the open-ended responses. And we think that the consistent patterns in response are evident between physicians, nurses, and professional allies, and between youngest and eldest respondents. Among the limitations, we know that the sample is not like to be perfectly representative of the Caribbean healthcare workers, that we were not able to know what portion of the healthcare workers heard about the survey in time to participate, nor if those who heard are similar in demographics and attitudes to those who didn't hear. We don't know what portion of those who learned of the survey decide to participate. And because of the sample is likely to be clustered by profession and location, some responses could be correlated with each other. And because the instrument was developed at the beginning of the pandemic, the instrument didn't account to people who had already been vaccinated. Next. Finally, I want to acknowledge the contribution of all PAHO representatives and focal points for the dissemination and follow-up in the survey in the participating countries. We want to thank our colleagues in WHO for their support and guidance with the study. And finally, we want to our deepest thanks to all the healthcare workers who took the time out of their busy schedules to answer this survey. Thank you very much.
Thank you so much, Dr. Valendia, and thank you to Dr. Puertas for that comprehensive presentation, just taking us through all that the study found and what happens after the study, because it's so important. The study is just the beginning. After the study comes the work of how we saw the communication strategies being developed, the capacity building and the training for the healthcare workers and other stakeholders. Equally as important is the policy development, because if we don't have the policy as an overarching framework, then our activities can become lost. And again, all of those additional communication messages. So now I'm going to go to the questions in the chat. We have a few questions here, and I'm going to ask Dr. Puertas to answer the first question. Was approval received from ethics committees in all participating countries? And this question comes from Donald Simeon.
Thank you very much. I just want to point out the link to the full report that we showed on the screen, and also that Lauren Bulanovic shared in the chat as well. So for those who are asking for the full report, there you would find it. Thank you very much for the question to Dr. Simeon. We had approval from PAHO-ERC, which is our ethics committee, since we use the sub-regional sample size. For example, in the case of Trinidad and Tobago, that they are using their own study, that's going to be a different situation. But in our case, we had the chance of just presenting a sub-regional sample. So we're not, as you saw, inferring to any country. We're just inferring to the sub-region, which is the Caribbean. And that's why we only use the sub-regional PAHO-ERC approval. Thank you very much.
Thank you, Benjamin. And the next question, what are the reasons behind low participation in the study from certain countries, example, Guyana? And this question was posed by Fiona Prasad. Dr. Valandia, would you like to take that question? Or are you going to take it again, Dr. Puertas?
Either one. I just wanted to say that during that time, remember that Guyana was going through an election process, and they were just having the new government into place. So that's one of the reasons why the change in administration and those considerations were probably one reason why we didn't have as much participation. I don't know if Dr. Valandia wants to add anything else.
No, for now.
Okay, and the third question, we have Donald Simeon again. He's congratulating us on a very important study, and we already answered the question about the being available on the PAHO website, and he is asking, what are the reasons for the higher levels of skepticism among nurses and allied health professionals? Is targeted intervention needed?
Yeah, I think that we need a targeted intervention. And also not just between the categories, but also with the youngest. As you saw, the youngest were really reluctant to many of the things that we asked about. So it's very important to target the interventions for them specifically. And of course, the social media will be one of the channels that we have to use for increasing their acceptance to the vaccine. Over.
Thank you. And a question from Irene Melamed. She says, thanks for the interesting presentations. And do you consider that the differences in responses between younger and elder healthcare workers may be mainly related to the different risks that these groups face in relation to COVID, or there may be other underlying factors?
May I?
Sure, go right ahead.
Thank you. I think this is a very good point, but that's why we need a specific intervention, communication intervention, because of course they don't have a lot of burden of disease, but the problem is they could transmit the disease. So we need them to at the time to get the vaccine, they have to take the vaccine and avoid the surge of the apparition of new variants, and also to decrease the transmission of the virus. Over.
Thank you. Dr. Puertas, would you like to add to that? Dr. Puertas, you're muted.
Oh, sorry, yes. I think Marta covered it very well, but I just wanted to add that Dr. Donald Simeon had additional questions. And again, some of them you will be able to find the answers in the full report. I think they are very relevant. He's talking about the quantitative representation of the qualitative research. And yes, we did that. And there's a whole process in which the team divided in groups, having two people working in the qualitative and one who was an expert in quantitative working together. So yeah, that methodology is specified in the full report. He is also talking about the higher levels of skepticism among nurses and allied health professionals, but that's something that Marta already responded. But remember, Dr. Belandia, she mentioned about critical care nurses, and this is something that really caught our attention. Because my first belief was that they are going to be the first ones to go and get the job because they are exposed. But then talking to them, we got several responses from chief nursing officers, and they were saying, well, they were the last ones to be trained in the vaccine because we started with the primary care nurses, with public health nurses, ward nurses. So by the time they reached the critical care nurses, they were not as trained as the other ones were. So because probably they thought that they were sufficiently trained in COVID-19, but at the beginning of the pandemic, nobody knew about the pandemic so much. So those are the questions. I call again and invite you to go through the full report, and you will find many more details that we can provide at this moment. Thank you very much, Karen.
Yeah, thank you. And Dr. Puertas, I'm going to ask you to just address the question from Maria Isabel Lopez. Okay.
Oh yeah, I see it.
Okay, good.
Yes, it's in Portuguese.
Oh.
Sorry about that, Karen. Yes, it says in parabéns, it's an excellent study. What inclusion criteria for the participation was used in the research? And then it says, I'm trying to remember my Portuguese, so sorry about taking.
And I appreciate that.
And it says those healthcare workers who were vaccinated do not participate in the research. That's a very good question, Dr. Isabel Lopez. But just to remind you that at the beginning of the study, when we started, the vaccine was not available in the Caribbean subregion. And that was the idea of the study, to do it before the vaccines arrive into the Caribbean. So the idea was to have the good knowledge of what concerns attitudes and intended practices. And that's very important, intended practices, where we're going to expect among physicians, nurses, and pharmacists in the Caribbean and other healthcare workers. So we didn't assume that they were or were not. We actually assumed that the vaccine was not there yet. And in terms of the criteria, we used the National Health Workforce Account list and category of healthcare workers, that's WHO, to list the workers that we wanted to approach, and then we divided them in subcategories to them. So that was one. The other inclusion criteria was that they should be part of or working in any of those 14 participating countries. So that was also another inclusion criteria. And I think I responded most of it. Thank you very much. Back to you, Karen.
Thank you. And we have a question from Khadija Khan. Was an interaction between age and job category explored to help explain higher vaccine hesitancy in the youngest age group?
Yes. As Benjamin mentioned, we did a logistic regression for each of the possible interactions. So I don't remember at the top of my head, but we have the results in the full report, so you can review which of those interactions are most important, and you can identify them because they are, of course, statistically significant. So in the full report, you can find all this information. And thank you very much for your interest in the report. Thank you.
Right. And because we're really stretched for time at this time, I'm going to take one more question, and that's from Dr. Joy St. John. Is there any idea if the difference in the information sources by age and category of healthcare worker could explain the different perceptions of risk? Dr. Puertas?
I'm trying to understand the question.
Right. So Dr. St. John is asking if the information sources by age. So we know that some persons have, because elderly may not have the same information source as a young person. The elderly might be TV, whereas a young person is social media. Is by category of healthcare worker, could explain the different perceptions of risk?
Definitely. In terms of social media, we know that younger age groups are more willing to look into WhatsApp, Instagram, Facebook, or other sources of information to see and find information on vaccines. Meanwhile, we saw that the older groups, they rather go into more reliable sources of information, or traditional, I would say too. So yes, in terms of age. Category of healthcare workers, that's something that we really need to go into more detail. And that's why in the policy brief that I will present later on, that's something that we are proposing, that we need to monitor this continuously, because the situation can change. Now that we have vaccines, it's a different scenario than compared to when we started this analysis. So category of healthcare workers, with the most important and significant differences were between physicians and nurses. So the information source applied to both of them, and probably affected more nurses than physicians.
Okay, thank you very much. A very interesting discussion, a lot of questions. We're going to try and answer those questions for you as the webinar goes on. And I want to just, before I introduce the next presenter, just remark on something that struck me when the presentation was being done. Everyone agreed that vaccines are important for their health. And that struck me as so important. The recognition of the role of vaccines in the reduction of illness, death, childhood morbidity and mortality, and those now for adolescents and adults. That is recognized. So I just wanted to end with that, because that really struck me from the presentation. So I am now going to go on. Thank you so much, Dr. Puertas and Dr. Valandia. I'm now going to go on to our next presenter, and this is Lauren Velanovic, the communications specialist in the Family Health Promotion and Life Course Department, and she's going to present on PAHO's response, tools and materials to support vaccine uptake among healthcare workers. Over to you.
Thank you so much, Dr. Broom, and good morning, good afternoon to everybody. I'm going to run through this presentation pretty quickly, because I know we're running a little bit short on time, but just so you have an idea of some of the things that PAHO has been doing, or materials that are already available to you. We know healthcare workers are key, and you've heard a lot about this from the previous presenters, so I'm not going to go into it right now again, but I just wanted to mention that even before we did this specific study, and even before the COVID-19 pandemic, we've always said that healthcare workers are the heroes of the immunization programs, and just how important they are when it comes to being trusted sources of information on vaccination, and really what are vaccine advocates in the community. And so just recognizing the absolutely critical role that they play. With that in mind, we have a couple of materials that I would like to share. This first one is communicating about vaccine safety. These are guidelines for healthcare workers, so they can have more guidance on how to communicate with parents and caregivers and patients about vaccine safety. So this is a very practical document. It does go into a little bit of the theory at the beginning of, what are some of the factors that can determine whether somebody will accept vaccination or not? What are some of the barriers that might be there? But then it really gets into the practical things of how to communicate. If somebody, you know, when patients come in, when health systems users come into the clinic, you know, how do you have that conversation? What do you say? If they say this, how do you respond? And we've had this material is available on the PAHO web, and I'll put the link in the chat after this presentation. This is available in all 4 PAHO languages. And as Dr. Valendia mentioned earlier, we are publishing, we have this in a virtual course that we will be publishing in the PAHO virtual campus. I also wanted to mention that in this document, there's a specific section in there on how to communicate with not just patients, but also your peers. So if you are a healthcare worker and somebody else you work with expresses some sort of doubt or hesitancy about vaccines or vaccination, how can you respond? And so this is a really useful material in that sense. Now, after we had published that already, we started to see that there were a lot of questions that were circulating about vaccines, how they're developed, and then, of course, specific to COVID-19 vaccines. And we were doing a lot of social listening activities where we were, you know, really plugged into what healthcare workers were saying on social media. We had meetings with some EPI managers, including several from the Caribbean, and just kind of tried to get the pulse. What are you hearing on the ground? What are some of the questions that you're hearing? What are some of the questions that you have? What are things that you're not quite sure about? And we developed this other document, Key Messages and Answers about vaccine safety. And it's basically an extensive frequently asked questions. And we gathered up all those questions and we put the answers in there as WHO answers, as the US CDC answers, or the European CDC, and tried to make a really practical resource so that if you know you're a healthcare worker and somebody comes in with a specific question that you don't have the answer to right off the top of your head, you could use this as a resource. And then within this document, there's 2 sections. There's one on routine immunization, and then there's one that's specific for COVID-19. And in both of those sections, there's also like an annex that has some of the tricky questions, how to respond to some of those questions. So, you know, what about the use of mercury and antibiotics in the vaccines, things like that. So those are all, again, right there with the idea of being super practical. We also have WHO resources. You can see here, this is a communication for COVID-19 vaccination, a flow diagram that healthcare workers can use. There was a statement for healthcare professionals put out on assuring people of the safety and effectiveness of the COVID-19 vaccines. And then, of course, this data for action material that's been referenced in earlier presentations. There's also been several communications materials, campaigns that have been done. You can see here, this is just a few of them. There's a lot more. If you go to our website, you'll see the really big variety. But just to mention a few here, we've got you know, these myth busting videos that were done in collaboration with Facebook that addressed, you know, we took the 10 most relevant or prevalent myths going around at that time and answered those in really short videos. There was the campaign that was done in the Caribbean, the Vaccines Bring Us Closer, Choose to Get Vaccinated, that had public service announcements. There were materials, graphics materials, again, addressing some of the main concerns that we saw as a result of this study. We also had to address the issue of brand preference that Dr. Valendia was just talking about, where people said, well, I would get vaccinated, but only if this specific brand were available to me. And so far, it hasn't been available. A campaign that really encouraged people to take the first vaccine that's offered to you, because the vaccines are safe and effective, and that's what you need, you know, that protection. Campaigns where we've done, whether you're vaccinated or not, continue with the social public health measures to stay protected. We have a frequently asked questions page within our COVID vaccine page, that we also try and keep updated constantly with as we get new questions that people write in on our website, questions that we get from the media, that we see on social media, to make sure that that information is the most relevant information is always really accessible, easily accessible. And then we've also done several Ask the Expert live sessions with PAHO experts on social media. We stream it on Facebook, on Twitter. There's one coming up this afternoon at 5 o'clock Washington, DC time that will be done in conjunction with some youth leaders from our region. And another one coming up next week, but where we have these dialogues we ask the experts questions that we see. How do we know the vaccines are safe? How do we know that they're effective? Will they really protect me? What if I've already had COVID? Do I need to get vaccinated again? And then after we have these, we've been, making these short videos, these clips that we also put on social media again. And as I mentioned, everything is available on the website here. This is just a few images from a few sections on the website. There's so much more. It's a really extensive site. So I encourage you to check it out, but you can get an idea of some of the materials that we have on there, from everything from tag recommendations to social media resources, frequently asked questions. Our recordings from all of our events and webinars are available under the events section. We've got technical and scientific products, communications materials, videos, just a whole lot more. So please, if you are not familiar with our website already, please check it out. And again, I will put this link in the chat for you. So thanks very much for your time and attention.
Thank you very much, Lauren. And a quick presentation, but it really showed the wealth of information that is available, the communication materials that are available on the PAHO website, and what we continue to work with. And in the interest of time, we're going to go straight into the next presentation. I'm going to ask Dr. Puertas to come back again and give us a presentation on policy brief proposal, addressing vaccine hesitancy among healthcare workers in the Caribbean. So Dr. Puertas, we're going to go straight to you.
Thank you very much. Let me open the presentation and share it with you all. Okay, so you should be able to see it now.
Yes, we can.
Okay, perfect. So
once you put it in presentation mode, lovely.
So what I'm going to present now is a draft policy brief called Addressing COVID-19 Vaccine Hesitancy Among Healthcare Workers in the Caribbean. And this is the work of PAHO and the Human Resource for Health Action Task Force. So we have seen that the impact of COVID-19 on HRH and policy response is broad and wide. It has affected the health system preparedness, impact on COVID-19 on healthcare workers, planning on mobilization, policy measures, financial implications, health and safety, and of course, vaccination, as we have witnessed. In November 2020, during the 39th COSOT meeting, the COSOT is the Council for Human and Social Development at CARICOM, mandated the establishment of an HRH Action Task Force for the Caribbean, which was launched in April 2021 with official delegates from 12 countries and 2 territories in the Caribbean. During this meeting, the delegates approved the terms of reference and the work plan for the task force, and approved that PAHO will act as secretariat. In 22nd of September 2021, the delegates of the HRH Action Task Force met to review and provide feedback to a draft policy brief that previously was shared, and also a questionnaire online was provided to get additional feedback from the countries. This is the mandate from the Ministers of Health at the 39 COSOT meeting, in which the COSOT mandated the CARICOM Secretariat in collaboration with PAHO and other key health institutions, the establishment of an HRH Action Task Force to advise and monitor the development of public policy in the countries and territories of the Caribbean. Here is the work plan. I know that the wording is very small and I apologize for it, but at least you can see that as part of the approved work plan, we have the development of a draft policy brief on healthcare workers and vaccination hesitancy. And as background document, the report that we just saw, the main findings before, that's the concerns, attitudes, and intended practices of healthcare workers to COVID-19 vaccination. Later in July, that's very recently, during the 42nd regular meeting of CARICOM heads of government mandated the CARICOM Secretariat to continue to collaborate with CARFA, the Pan American Health Organization, PAHO, regional nursing, medical, and allied health professional bodies and institutions to identify strategies and policy guideline papers to address vaccine hesitancy using an evidence-based approach. So that brought us to this point of working a draft policy brief on addressing vaccine hesitancy among healthcare workers in the Caribbean. The key considerations, most of them you already heard in the survey study presentation. So we know that vaccine acceptance was 77%, lower among nurses than doctors, and among younger age groups. 30% agreed that they don't know enough about the vaccine to decide. 30% reported that social media shaped their opinion on the COVID-19 vaccine. And the qualitative analysis also showed that healthcare workers, they have a lack of confidence in vaccine benefits, perceived disease risk to self, confidence in vaccine safety, and lack of trust in new vaccines. So we also heard in the communication strategy presentation by Mrs. Mulanovic that behavior change is at the heart of addressing healthcare workers' vaccine acceptance, and that tailored integrated multi-component strategies achieve greater effects on vaccine uptake. So we also saw this slide before, so I won't go into much more details, but you know what's the situation in the Caribbean. The recommendation in the policy brief draft, the recommendation is to strengthen COVID-19 vaccine promotion among healthcare workers by targeting vaccine hesitancy drivers. So out of this main recommendation, there are three components that you can see there. One is systematically monitor drivers of COVID-19 vaccine acceptance among healthcare workers. The second one has to do with targeted interventions promoting vaccine acceptance. And the third one, evaluating the impact of these interventions. So let's see each one at a time. The first one has to do with the monitoring of drivers of COVID-19 vaccine acceptance. In one of the questions that I managed to see, there are many, so I apologize. I've been trying to respond to as many as I can, but there are many questions. But Dr. Majum there, he was asking about follow-up studies. And yes, I completely agree with you that we need to systematically monitor what's happening in the region among healthcare workers. So what we propose is routinely measure the barriers and facilitators of COVID-19 vaccine acceptance among healthcare workers to guide interventions. And this is something, this analysis, even now that we're talking, could have changed in many countries because of different situations, you know. So that's important to continue. Number two component, which has to do with targeted interventions promoting vaccine acceptance among healthcare workers in the Caribbean. In here we have, as part of those interventions, those that are related or based on risk communication and community engagement. We also need to incorporate interpersonal communication training, especially on vaccine safety and related issues, and behavioral and social drivers of vaccine acceptance. So those are the interpersonal communication training that the HRH Action Task Force is proposing. And finally, the third component has to do with evaluating the impact of the interventions. And this component has to do with doing impact evaluation and data-driven and iterative strengthening of interventions. So as you can see, this is a policy brief, as we mentioned, but still it has added value by implementing this recommendation, and that includes interventions target specific groups of healthcare workers with low vaccine acceptance. So that's very important to tailor the interventions and to target the interventions to those groups of healthcare workers where we have the situation. Increased efficiency and effectiveness of resources allocated for promoting COVID-19 vaccination. Successes and lessons learned can be applied to strengthen national immunization programs in addressing vaccine hesitancy in the wider public. Remember, when we started the event, we mentioned that 85% of the public, they trust and follow what healthcare providers tell them about vaccination in this case. So that's very important. What are the gains from addressing COVID-19 hesitancy among healthcare workers in the Caribbean? A health workforce resilient to COVID-19, sustained health services delivery during COVID-19 and other pandemics, strengthened health systems to respond to COVID-19 and other pandemics, health protection and health security of CARICOM peoples, and strengthened national and regional security. So we can see that benefits extend beyond COVID-19 pandemic, and that's important that we all understand. What is the scope of the policy brief? It's regional, it's the Caribbean, and it's up to the countries then to adopt and adapt the recommendation and the components that this policy brief draft has for the countries. And we're going to have a great opportunity next October 12 and 14, when the 41st COSOT meeting will meet. The first day is the CMOs, the Chief Medical Officers, and the second day, October 14, Ministers of Health. And we have as points of the agenda 2 items. One is the presentation of the policy brief on addressing the impact of HRH and COVID-19 response to this pandemic and other pandemics. And the second policy brief, the other agenda item, is the presentation of this policy brief on addressing vaccine hesitancy among healthcare workers. So we hope that on that day, this policy brief will be approved and it will become a mandate to CARICOM. So that will allow us to continue supporting and working together with the HRH Action Task Force and CARICOM to improve the situation in general of the health workforce in the Caribbean. That's all I got. So thank you very much. And back to you, Karen.
Thank you very much, Dr. Puertas. And we are now going to take a couple of questions. I'm very aware of the time we have gone over, but I think it's really important that we answer 2 of the questions that have been posed in the question and answer. So the first question is, what of COVID recovered healthcare workers who state that natural immunity is at least as protective as vaccination and therefore decline vaccines? What evidence basis do we have to press or in some places require that they be vaccinated regardless? So this question is really asking about how do we convince healthcare workers who have already had COVID that vaccination is important? Mrs. Velenovic, do we have any material, communication material that Erica Frank could possibly use in order to target healthcare workers that are feeling this way?
That's such a great question. So thank you for that question. And that is something that we have been seeing a lot from the general public as well. No, this question of, okay, well, if I've already had COVID, why do I need to get vaccinated again? I'm going to look for, I think we have some specific language on our website, so I'm going to try and look for that real quick and put it in the chat there for you, and also the link to where we have that language so you can use that as reference. So thank you again for that great question.
Wonderful, thank you. And I have a question here. Should vaccination be mandatory for healthcare workers and health professional students in the Caribbean? So I am going to take the liberty of responding to this question to say that PAHO WHO's recommendation at this point is that persons be encouraged. Communication should be targeted to persons who are hesitant. It is so important to find out the reason for the hesitancy so that it can be addressed, whether that be through education, whether that be through information, directing them to trusted sources of information, whether that be listening to persons who have had COVID, who have had the COVID vaccine, persons telling their personal stories. So PAHO WHO encourages the use of targeted, effective communication to influence persons or to encourage persons to be vaccinated, and has not recommended that vaccines be mandated at this time. So I'm just looking in the chat, and one quick question to Benjamin, and then we will close. Are the nurses in the study BSN educated?
Thank you very much. Well, we don't have, remember that we had a close-ended questionnaire, and just 5 questions had the option of adding additional information of that required. So we don't know if those nurses who participated are or not educated through this way. So sorry to say that. Yes, and there are many questions about that too. So remember, and I wish we could have all the answers, but we don't. There's one very interesting question that goes along that question that you just mentioned, and that has to do with the training of nurses and the continuing education of healthcare workers. I think now the big challenge is to maintain that, the training of healthcare workers, but also we have to think in academic institutions and the more formal training, because we need to develop a curricula and competences that incorporate all these elements. So we won't see anymore the question and the percentages we saw in the question. We don't know enough about vaccination, you know, and that's something that really was important and even statistically significant to take care. So training and formal education is very important for healthcare workers in terms of what we're seeing.
Thank you. I see, Dr. Belandia, you have your video on. Did you wish to make a comment?
Yes, I just want to answer the question that is in Spanish. Because she's asking about the number of persons that have been receiving the vaccine. So I want to share with you our PAHO dashboard, so you can find all the information regarding the number of vaccinated people in the region in the dashboard. So more than happy to share the link here. And the other question that I think is very important is she wants to know when the other studies in the region will start. So we are looking forward to work with countries developing this kind of studies. So we request, if you want, if you need, if you are interested, please let us know through the PWRs in your country for us to identify who will be the person we will work and everything. So we are more than happy to hear from you regarding your interest in doing this kind of studies in your territories. So thank you.
Thank you very much. And I see the link. Mrs. Valanovic has posted the link in the chat to the communication materials on the question about persons, healthcare workers who have recovered from COVID-19 and the vaccination. Thank you very much. At this time, I would like to invite Dr. Andres de Francisco, the Director, Family, Health Promotion and Life Course at PAHO, to give the closing remarks.
Thank you very much, Karen, and thank you very much for this extremely interesting and informative session. I have to say it was very, very well presented, and it shows us how what we are doing here with COVID-19 is basically breaking new ground. It's an emergency. It's a pandemic that is getting into its second year and counting, with the social and economical havoc that is creating all over the world. And at the same time, we have a series of vaccines that have been researched and produced and are becoming increasingly available. And we have the issue of vaccine hesitancy, which is also fueled a lot by the information, social media, infodemia, and elements that have always played a role, but right now are playing a much higher role because COVID is putting us to live and work from homes. And because of that, we are actually getting much more living in a virtual world. And that complicates things, in particular, in this case, what we are talking about healthcare workers and information. And they, healthcare workers, are the most trusted individuals to provide the information. And I think that given this fact, this study that has been done, 12,000 individuals, 14 countries, qualitative and quantitative, is giving us quite a bit of information on which we can act. And perhaps the most important thing is working between CARICOM, CARPHA, PAHO, and working towards a policy, draft policy that was presented and that is going to be discussed at the following CARICOM meeting of heads of states. That is the whole round of information that needs evidence-based information into policymakers for us to be able to move forward. We have, as healthcare workers, the responsibility to understand which are the tools that improve health. And in this way, we will be doing our job well. What happens is that ourselves with these studies and work, we have to look for the way to provide that information. Our responsibility is to furnish this information. And this is what is being done here, not only for over 100 participants, but also with all of the tools that are available that were presented, that we have in our arsenal, including the courses, messages, videos, our website that has quite a lot of information that is being updated on a regular way, because the idea is to have this being fed back by the misinformation so that we can contrast the misinformation. So I think that we are really breaking new ground right now. And I would repeat a couple of things that were said, that even though we have hesitancy, in particular with healthcare workers, everybody accepted that vaccines have an impact to decrease disease and reduce morbidity and mortality, and that is very important. We also see that young people are more at risk in a way of this behavior with hesitancy, and part of it might be because there are young people that have more access to social media and have not actually seen the damages that infectious diseases can do, such as measles or even smallpox in its time. And we need to modify the way that we are operating. And I think that's what we are trying to do with this. So I think that's what I would say. Our responsibility is with healthcare workers, as they are our road to increase the trust in vaccines, and we have to do it. We all have to do it together. There will be future challenges, and we have to set things up from now. So I invite you to look at the material that was distributed, and I invite you to continue in these discussions. We talked about future studies that are going to be done. We will do them with you. And this information, we really, really hope it gets into policies, it gets into mandates, and it can get into people being vaccinated to be protected. Thank you very much for this session. And I thank the presenters, and I thank those who ask questions. And I also like to thank our chair, Karen Broom, who is playing a very important role with the immunization program, as well as all of the colleagues on immunization and at the sub-regional level, Benjamin, communications, Lauren, Marta being our focal point, Dean Chambliss, who opened the session. Thank you very much for this very exciting session, and we hope we will have additional in the future. Thank you.
Thank you very much. Those very thought-provoking closing remarks. And with that, all that's left for me to do is to tell every one of you, be safe, continue to spread the word about the importance of vaccination and promote the benefits of vaccination to your friends, your families, your co-workers, your clients, and have a wonderful rest of your afternoon. Goodbye.